Hey, good afternoon and welcome to Coping with COVID. I'm Tre Tailor. Information on the pandemic and updates to help you thrive and survive COVID-19. I'm Tre Tailor, and today we have with us the woman leading the state of South Carolina's efforts to fight and manage the coronavirus. Dr. Linda Bell, you can see her beautiful face right there, is the lead epidemiologist at DHEC, and she'll provide an update for us today and answer your questions. Of course, Coping with COVID is sponsored in part by SCDHEC and the City of Columbia Office of Business Opportunities. We'll be right back with Dr. Linda Bell in just a minute, but first, our COVID community updates. I want to tell you that SCDHEC and Prisma are continuing their ongoing COVID testing. For the most up-to-date list, visit scdhec.gov and also prismahealth.org for locations, dates, times, and testing in South Carolina. Now, DHEC's care line is also available 8 a.m. to 6 p.m., 855-472-3432. If you would like to organize COVID-19 testing in your community or at your event, there's an email address. You can email acc/testing@dhec.sc.gov. Also, you can call 803-673-6110 from 9 a.m. until 6 p.m. Monday through Friday. Now, there are a few testing sites this week that I want to mention. In Columbia through Thursday, you can stop by the South Carolina State Museum. Now, you do have to have an appointment. They're testing from 10 a.m. until 4 p.m. Go to krogerhealth.com/COVID-19 testing. Friday and Saturday, testing is being done at the Benedict College Stadium from 10 a.m. until 2 p.m. And as a matter of fact, through July 2nd, DHEC has scheduled over 120 mobile testing events throughout the state of South Carolina. So visit scdhec.gov and search mobile POP clinics for the full list. Also, the election runoffs are next Tuesday. Please exercise your right to vote. There is also online, or not online, but early voting going on. So you can stop by the voter registration office in your city or town in Columbia, South Carolina. It's at 2020 Hampton Street, and you can stop by their weekdays from 8:30 until 5 o'clock. And today is the 5th anniversary of the Emanuel 9 tragedy. Congressman Jim Clyburn is holding a virtual town hall meeting today at 4 o'clock. Now, I'm going to stream it live on my tailor-made production page, so please check that out. Also, to honor the 9, the 500 South Carolina AME churches are going to do a peaceful protest this Sunday called Faith for Black Lives. It's Sunday morning at 11 a.m. They're going to march from Allen University to the State House. And Dr. Bell, they are requesting the participants wear a face mask. That's your COVID community updates. Please check the bottom of the screen for more information. And we want to thank again SCDHEC and the City of Columbia Office of Business Opportunities for being a sponsor. Now, before we get to Dr. Bell, I want to remind you that we are going to move Coping with COVID to the Tailor-Made Productions page. So please make sure you go over to the Tailor-Made Productions page and like and follow that page so that you can not only watch Coping with COVID, but you can also get updates on COVID testing. We also Dr. Linda Bell is with us today. And listen, I don't know how appropriate this is, Dr. Bell, but I've just got to say, Black girl magic. Leading the charge in South Carolina. You have been the state's leading epidemiologist for 8 years, but you've worked with advocacy and research at DHEC since 1993. Now, I read that you did that because you said that was the largest way to make impact, particularly with people of color. Thank you so much for joining us today on Coping with COVID.
Thank you for the invitation.
Absolutely. We already have a lot of people watching. I want to thank Candace Belton says hello. Also, Marvell Williams Mendenhall says good afternoon, Dr. Bell and Tre. Cassandra Moody says hello, Tre and Dr. Bell. Meryl Johnson says hello. And also want to say Meryl Johnson says, yes, Black girl magic in the house. Allison Aristide is watching from Florida. Thank you, Allison, so much for watching Coping with COVID. So, Dr. Bell, already the latest numbers, 595 new cases, and this is from yesterday, 5 additional deaths, and almost 20,000 people have been diagnosed with COVID-19. And you've been doing the numbers since March, right?
We have, since we recognized the first cases in South Carolina.
Yeah. So why is it that our cases seem to be increasing? Because we did have a little dip, I guess, during quarantine, and now the cases are rising. What's going on?
Well, a number of things. When we think back of where we started in March and what we understood about the virus at that time and how it could be transmitted, we spoke about it being a respiratory virus spread similar to the way the flu is spread by large respiratory droplets. But we've learned a lot more about the virus since that time, that it is more easily transmissible than we originally thought. There were recommendations about early on about that there wasn't a need for the general public to wear masks because we did not think that we would see the level of widespread activity that we're seeing now. But most recently, we came from a period of increasing transmission and then a sort of a plateau. The plateau came into place because of the closures, the social distancing, the recommendations for how to prevent spread. Those are the things that we know work. And so when those things are in place, we can expect disease activity to stabilize. When with the announcements of the staged-in reopenings, there could have been a lot of misunderstanding that the reopenings meant that the risk was gone.
Right.
We did the reopenings to help people resume a more normal life. But I think that many, many people have missed the importance of maintaining the prevention measures. So we can safely do reopenings, but we still have to wear masks.
Yeah.
All the time when we're in public, and we still have to practice social distancing. So there are safe ways to do that. And the fact that that has not been practiced very widely, that the uptake of the routine use of masks, the lack of social distancing, we see large public gatherings.
Yes.
That's an explanation for why we're seeing a really alarming, very unfortunate, and rapid increase in the number of our cases over the past 2 weeks, because the only measures that we have are not being widely adopted.
Now, Dr. Bell, I know, and I'm not surprised because I live near Five Points, and you would think that it's just a normal, you would think it's June of 1999, June of last year, like nothing has happened. And I agree. And I know that this is tough. It's got to be tough for you and Governor McMaster's and everyone that is working toward this effort, because as you said, you want people to get back to some sense of normalcy, but people are just not getting that means normalcy with these other things in place. So how can we, force or encourage or make people get it that you've got to wear a mask? And, you hear people say, well, it's getting hot. It's too hot. Well, would you rather wear a mask or a ventilator?
Thank you. Yes. And you make some great points. And part of it, as a public health official, I want to take responsibility for. So as on the platform that you're providing here, as we give this messaging, is there some failure on our part where the messaging that we're giving is not resonating? That people, do they not understand the risk? Do they not have access to the recommended measures? That's one possibility. The other possibility is they don't believe that they are at risk, or they are, many people say, well, this is just an inconvenience, just as you said. It's too hot. I want to lead a normal life. And so the lack of appreciation we have a very limited number of tools. We don't have a vaccine. We don't have effective treatment. It's easily transmissible. So with these very limited tools, if we don't do those things and accept that it's not just an inconvenience, we recognize that this is an enormous sacrifice. But unless we make that sacrifice, we are looking at two options. We can widely adopt and much more rapidly decrease the trends, or we can drag this out and continue to see illnesses, hospitalizations, and even deaths. And for those people, especially our young people, when you mentioned 5 points, it was so disheartening to see the activity in 5 points early on among, our young college-age students.
Yeah.
That age group tends to feel that they're really invincible. But
Oh, yeah.
unfortunately, we are seeing complications, hospitalizations, and deaths in every age group. It happens to be higher in older individuals, but we are all potentially at risk of exposure, and we're unfortunately all potentially at risk of getting really sick.
Mm-hmm. Yeah, and you say everyone is potentially at risk because everyone, of course, is not adhering to the recommendations, your recommendations.
Yes.
Yeah.
So how to ask people to weigh that sacrifice? We know it's a sacrifice, but can we ask ourselves what can you do? What can we each individually do in terms of a sacrifice and that inconvenience to make this better for all of us and
Yeah.
shorten the course of this really devastating impact on our lives, on our economy, and there's a way to achieve normalcy more rapidly if we can, through any format, any help that we can get in getting those messages out, that the risk still does exist. And in fact, it is much higher now than it was before because of increased activity, and it's summertime.
Yeah.
And there are lots and lots of large gatherings now without social distancing. So there are safe ways to do it.
Yeah. Dr. Linda Bell is with us. She is the state of South Carolina's epidemiologist. I want to mention that she is having a bit of a connectivity issue. So if she freezes, then you know what's going on. Rhonda Perry says, Dr. Bell, masks are temporary. Death is permanent. Maxine Moses said wearing a mask needs to be mandatory. Is that something we can do? I know that here in the city of Columbia, the city council is talking about that, and we're going to have someone on tomorrow to talk about that. Is that something you would be on board for?
Well, mandatory is a tricky word. I am so proud of our city council and of our mayor who have initiated. I think I'm getting this right. I think it's called the Resilient.
Yeah, Resilient Columbia. Yes. Mm-hmm.
And so, while we can't make certain things mandatory, apparently, but we can ask businesses to adopt the recommendations and to show that we're a business that value your safety and that we are taking these measures to make sure that our patrons who come here, that our staff will mask, that we're following the highest practices for hygiene. So the Resilient Columbia Pledge is a model of something that we would like to not be in a position of having discussions about making it mandatory, because through voluntary acceptance, through businesses saying, we're going to take responsibility for this. And as we've talked about individuals, so the issue of making something mandatory in America, we have, there are just different practices here. There are things that we stomach. But when we look at what was done in South Korea and what they learned from a previous widespread pandemic that was devastating, they immediately took measures. They had 4 cases of COVID-19 in South Korea, and within a matter of days, everybody had on a mask and everything was shut down.
Right.
And they so quickly recovered. And we would love to see that here.
Yeah. Regina Williams says large group gatherings, refusal to wear masks. She said it may be possible not to give permits for large gatherings. Deborah Abraham says 4 of her family members have died in the last 2 months. She says that rural communities are not getting tested. Orangeburg County, Vance and Holly Hill and Santee. But I know that SCDHEC has, as I said in the opening, several testing sites throughout the state of South Carolina.
We have, early on, it became evident when testing supplies became more widely available. That was an issue early on. But DHEC actually conducted an assessment from the test results that we were receiving early on. Where were those test results coming from? And how far were people having to travel to get testing? And so in response to that, we not only did we seek to widely expand testing capacity as rapidly as possible, but we deliberately sought to put testing sites, pop-up sites, mobile sites, and to collaborate with community health centers to bring testing to areas where it was clear that there was not ready access to testing. And we're continuing to do that with the mobile sites. So the availability of testing is a real issue in rural area, just as access to any kind of care and healthcare providers is an issue in rural areas. And that is one of the contributors to why African Americans are at increased risk for complications, because they're more likely to have chronic conditions, and they're also more likely to have poorly controlled chronic conditions because of limited access to care, underinsured individuals and things like that. So the issues that our rural communities struggle with are some of the things that DHEC is trying to address, not just for COVID-19, but for all chronic health conditions, or other chronic health conditions, I should say.
Yeah. Yesterday, a viewer said that they went to a restaurant and the workers there were not masked or gloved. Dr. Alexia Gaffney, who is a triple board certified infectious disease specialist from New York, she was on the show yesterday, and she suggested that we should leave or report it. And is that in the state guidelines that restaurant workers have to be masked or gloved?
No, it is not a requirement. So beyond the our regular food safety principles that permitted facilities are required to adhere to, the use of masks and gloves is not part of that. But I guess I didn't finish my thought about the Resilient Columbia Pledge. What we would like to see is patrons let businesses know that if they're not following practices with the uniform use of masks requiring their employees to do that, they should let businesses know that we probably need to patronize businesses that are valuing our safety. And so as businesses, if businesses learn that they may lose customers, if there's a whole economic issue to this, that we as patrons and customers can have a voice.
Yeah.
And businesses know that this is where we want to get our services, where we know we're safe.
Yeah, I absolutely agree, because, and that's what I said yesterday to this particular viewer, money talks. If we say as consumers, I will not patronize your business, as you said, if you okay, so the tables are, spaced out 6 feet. But if your folks are not wearing masks and gloves, then as you said, Dr. Bell, you don't value me. Well, you don't even value yourself, but you don't value me. So why should I patronize you? If you hit people in the economy, as the quarantine did, I think that speaks so loudly.
I agree.
Yeah. A viewer also mentioned yesterday that she went to an infusion center and the employees there didn't wear a mask. And she was told that they couldn't force their employees to wear one at an infusion center.
That's a pretty troubling report, because in contrast to what we can require restaurants and certain other kinds of businesses to do, and an infusion center, we'd have to understand the setting. But in healthcare facilities, there are requirements for the use of personal protective equipment in certain settings. I'm assuming that if it's an infusion center, that they're providing infusions for chemotherapy. So those patients who are immunocompromised and at increased risk. So if an infusion center is not set up with engineering controls, with administrative controls to space out the infusion seats, to require staff to wear masks, that is a concern. And if that's a licensed facility, again, there are a variety of different kinds of settings that are, and some are not regulated. So, but as healthcare providers who should be more well-versed in this than any of the rest of the population, the observance of infection control practices with a high-risk population like that, of people who may be immunocompromised, if that's occurring, that's a very concerning report, and that should not be happening.
Dr. Linda Bell is joining us on Coping with COVID. She is the state's epidemiologist at DHEC, the person that is spearheading our fight for the coronavirus here in South Carolina. Dr. Bell, Rashida McFadden says, thank you for everything that you're doing, Dr. Bell. Deborah Abraham commenting to your previous comment about the rural areas. She says, there are poor white folks living down there too. So, yeah. And I mean, I'm sure you're talking about everyone that's living, in the rural areas, but particularly, African Americans, because we are at higher risk.
We are. And before I comment on that, I would like to take exception with one comment that you made, although I thank you for this comment as well. I am spearheading this. I do want people to know that there is an army of public health professionals statewide who are working in healthcare settings, our healthcare providers, our public health workers who are the front line, making contact with cases and doing these investigations. So, Trey, this is not new.
Yeah.
It is public health workers, first responders, healthcare providers who are doing all that they can with the tools we have to keep people safe. But I do thank you for also mentioning that there are certain populations who are at increased risk. I think many of your participants here may be familiar with the increased risk for complications among African Americans and those who have chronic underlying conditions like heart disease, diabetes, obesity, underlying lung disease. But an additional thing to pay attention to is that not only are, say, African Americans at increased risk for complications should they be infected, there's also the potential that they are actually in increased risk of being exposed. So if as many African Americans work in essential jobs where they cannot social distance,
right.
As many of us are teleworking, some people have to go to work. Some people have to work in settings where masks may not be provided. They may have to use public transportation where they can't social distance. So those are many factors that put them at increased risk for acquiring infection. And should they become infected, they're at increased risk for suffering severe consequences. So those kinds of factors for your audience to be aware of and to understand why it is ever more important than for our communities to follow the measures to protect ourselves from exposure to begin with, yeah, and possible complications.
Hameen Shabazz, Dr. Bell, says, thank you for reiterating this information. He says he's sitting at his doctor's office right now, and the healthcare worker have masks around their necks.
Okay. Yeah. And so we do see people
which protects nothing.
they're making the effort, but we do see the masks that are under the chin, where they may cover the mouth and not the nose. And so the virus can be introduced into the mouth or the nose and actually in the eyes.
And not your neck, right?
Right. And not your neck, no. So if you're going to have it down here, you might as well pull it up 2 inches and let it do its job.
Yeah. Mouth, nose, and you said, and do you recommend eye coverings too? I mean, that's glasses or sunglasses?
Well, these are measures for the general population. Sure, glasses are great because they can offer, some protection. You can never predict when somebody in the line in the grocery store is going to cough or sneeze.
That's right.
And with our gaining understanding of this virus, it's not necessarily these larger respiratory droplets that do not remain suspended for long. We're learning that some of them do remain suspended. So the airspace can be contaminated even after someone in the aisle in front of you has left that space.
Right.
So wear the mask. Eye protection is really indicated for individuals in healthcare settings who are at increased risk of routinely having face-to-face contact with sick people.
Gotcha.
Sunglasses, glasses, things like that for the general public health, but we're not saying that everybody should have on a face shield.
Yeah. Tell us a little bit about what goes into fighting a pandemic. You mentioned that it's a whole team of people. Tell us a little bit about that.
Well, that's a great question. And so maybe to just outline, one of the things that we need is good surveillance systems. Mm-hmm. And these are international surveillance systems. when these unexpected and unexplained cases first sprang up in a distant province in China, there are actually international disease surveillance systems. And when they recognized that there was person-to-person transmission, there were alerts available very early on from the World Health Organization, from CDC, and so forth. So our state health departments monitor that information. You asked about when we had our first cases here in March in South Carolina, but our disease control team began our response efforts back in January.
Wow.
We began creating guidance, making sure that we had surveillance systems in place, that we could detect unexpected illnesses, and that we were asking our healthcare providers to be vigilant of these so that they could report them to us. So recognizing unexplained occurrence of disease is part of it. And then responding to that. The other part of it in public health is to investigate, so that when we identify cases on an individual level, we interview them, find out, have you traveled? Where have you been? Who have you had contact with? What are your symptoms? That helps inform the public health community and also helps us implement disease control measures. But it also helps us understand who's being affected, where do they live? And this helps us target our intervention so that in geographic areas, when we will say, hey, our disease control data is telling us that the demographics are that it's older people at first, it's African Americans later on, it is these chronic conditions. And it's that kind of information that helps us inform our preventive practices. The hope is with prevention, but once it gets out of the bag as it is now, it's all about control. And we implement isolation measures for those who are sick and quarantine measures for those who are contacts to make sure that they don't become sick while they're out in public. So, you have to stay home for 14 days after you've been exposed so that you're not unknowingly spreading the disease. And so that's just a real highlight of how we do things in public health, is the practice of population-based medicine.
Fascinating. So what about contact tracing? Let's talk a little bit about that. I remember when I first found out about the contact tracing, and I immediately thought, what a great way to reemploy some of those folks that have, lost their jobs. How is that being handled, Dr. Bell? And can you explain that to us?
I can. First, I'll say a little bit about contact tracing. This is something that we've done in public health all the time. This is not new to COVID-19. As we recognize that diseases are spread from person to person, for certain types of diseases, we will do investigations of those individuals. And then confidentially, we will, depending on how the particular disease is transmitted, we will find out who their contacts are. We don't reveal to the contacts where they may have obtained the infection or potentially been exposed. And so this is a long-time public health tool. And we did see an opportunity because these are unprecedented numbers that we have to respond to. So with the furlough of a lot of healthcare workers, we did have many responses that, hey, we can help. So we were able to rapidly hire a much larger number of people than the smaller number of contact tracers that we have for our routine disease response activities. And they're being trained in the principles of contact tracing, some of which I just explained to you, how to use our disease reporting systems and so forth to help them to reach out to those contacts, make sure that they understand the symptoms that they need to monitor for, to stay in quarantine for the 14 days. And so we've had a great response with a much larger number of people to assist us with contact tracing.
That's great. Do you know whether or not, Dr. Bell, they are still looking for contact tracers? Is that some jobs that are still available? Do you know anything about that?
So probably not, because we, in order to get up to speed as quickly as possible, we contracted with bringing on a bunch of people all at once so that we could get them all trained all at once, get them deployed and working all at once. And so at this time, we feel like we have the number that we need. There can be other opportunities, though, for people to volunteer as community health workers or in other capacities. If they have skills working with special populations, we can use people from other disciplines to help with everything from mental health, with social services, community health workers, educators, and things like that. So there could be other opportunities aside from that contact tracing.
Okay. Hamim Shabazz, the gentleman who just said he was at the doctor and everybody had their mask around their necks, he said he just told the receptionist to pull her mask up. She said it's too thick and it's hard to breathe. Can he say Dr. Bell said you should, you should, can he call the principal on her?
Yeah.
Hamid, Dr. Bell just said, so you say the state epidemiologist said you should pull your mask up. Gwendolyn Barnes said she had the same problem at her doctor's visit. She's actually the person I mentioned that was on. Gwendolyn, I mentioned to Dr. Bell about your being at the Infusion Center and having those types of issues. So it is disheartening, it's particularly at health, that healthcare providers, people are having these problems with their healthcare providers, but I digress.
It's not easy. They're not comfortable. Yeah. I wear it all the time when I'm in public, and sometimes you have to let the humidity release a little bit. It is not comfortable, but but you've asked the great question. Do you want to wear that for a few hours, or do you want to be on a ventilator for a few weeks? Right.
Yeah, Dr. Linda Bell is with us. She is the state epidemiologist here in South Carolina. She's, I'm saying this. She's not saying this. She's far too humble to say this. She's leading a group of people on the charge to control and manage the coronavirus in our state. We're going to take a quick station break or sponsor break, and we're going to come back with many of your questions for Dr. Linda Bell. We'll be right back with you, Dr. Bell. The Coping with COVID is brought to you in part by SCDHEC, Healthy Families, Healthy Communities. And want to mention a couple of things that Coping with COVID, visit SCDHEC for information, an updated listing of testing sites and important information on how to protect yourself, your family, and friends from the coronavirus. Go to SCDHEC, Healthy People, Healthy Communities. As I said in the open, SCDHEC has over 120 mobile testing sites going on through July 2nd in South Carolina alone. Again, visit SCDHEC for more information. Also, the City of Columbia Office of Business Opportunities is a sponsor of Coping with COVID. They help meet the needs of small, minority, and women-owned businesses in the city of Columbia, South Carolina. That's the City of Columbia Office of Business Opportunities. Want to remind you to go to the Tailor Made Productions page and like and follow that page, because very soon we're going to be moving Coping with COVID to that page. We're talking to Dr. Linda Bell, the state epidemiologist in South Carolina. If you have a question, please be sure to post it. Deborah Abraham says, Dr. Bell, that she thinks the state should give out a card saying if the person is negative for COVID-19. That's interesting.
Well, right now, the only tests that we have available are a test that detects the genetic material in the virus that tells us about acute diagnosis. And the test that we're really interested in, what I think the question is about, is an antibody test. Mm-hmm. And so there's another test that detects an antibody in the blood that develops in response to infection. But what we need to know is whether or not those antibodies offer immunity from infection. And so until there is a test available that says that you're immune, we don't have any kind of card or certification that once you've been infected, you can return to work or you no longer need to wear a mask because you're not at risk of being infected. And we don't have that at this time.
Right. So even if you had it, that's still not a guarantee that you can't get it.
That's true. They're conducting studies now to try and understand if there is a possibility of being reinfected. We know that with some diseases like, measles or the chicken pox, once you've had that once in your life, you won't get it again. Measles would be the best example. But there are other things. We know that we have seasonal flu every year.
Right.
The flu changes its genetic makeup a little bit every year, so we can be reinfected year after year after year if we're not vaccinated. And we don't yet understand whether or not we can be reinfected with COVID-19 once you've been diagnosed.
Mm-hmm.
So even if you have had the infection, you still have to observe those practices. So I do worry that people misinterpret what a negative test means. It's only a test at a point in time, especially if you've not been infected before. You go out and you get tested and you say, okay, I'm negative. That doesn't mean you can't be exposed, in the next week and then you're positive.
Because you could take a COVID test, be test negative, and 5 minutes later be exposed, and now you have it. Is that correct?
That's right.
Yeah.
So there's no certification that you're no longer at risk.
Right. That just means you're positive, you're negative right now, and you need to put your gloves and your mask back on, and then go back out and social distance.
Until we have some better tests that can, like other diseases, can tell us that we have immunity. We only have a few months of experience with this virus. So, as compared to the flu, where we have, decades of experience from one season to the next, we just don't know what to expect yet with COVID-19.
Let's go to a couple of questions. A couple of people posted some questions on the Tailor Made Productions page, Dr. Bell. They want to know places and activities to avoid, the best places and activities to avoid if you are trying to avoid COVID-19.
Maybe it's better to talk about activities, and because places, we can create safe places in most settings.
Okay.
We might talk a little bit about any setting where you will be for a prolonged period of time. So the activities to avoid would be crowds, where you cannot keep people at least 6 feet away from you. And, examples, and then another risk is the duration of exposure. So if you're going to have a relatively short period of time of exposure, we define a contact as someone who has had close face-to-face contact for, about 10 minutes. Mm-hmm. But if you're going to be in a setting with a lot of people and you're going to be there for a long period of time, you're amplifying your risk of exposure. The best example that I can think of that might be, think of church services.
Right.
So in our sanctuaries, in temples and in mosques and things like that, they can be set up where you can social distance. Mm-hmm. But is everybody in there wearing a mask? Are you actually staggered out in the pews? You're not passing collection plate? There are not shared items, having the communion rail. There are all sorts of risks that where there are measures that can be taken for harm reduction and the reducing the risk of exposure. So any activity where you're going to be in a large group of people, whether it's social, business, what have you, you have to practice the social distancing and the use of a cloth face covering to protect yourself.
Okay. You mentioned church. I'm going to ask that next, but Deborah Abraham has a question, Dr. Bell. She says she was in Bilo and a lady was spraying her personal can of Lysol. Should people be doing that?
Well, I can imagine what the reaction from the people around you might be. You certainly want to spray a disinfectant on another person, and that's not really a good idea. It's not particularly effective. Disinfectants are intended to use on surfaces, not on people. If they're using it in an airspace, it's really only serving the purpose as a deodorizer. It's not effective.
Wow.
I really can't recommend that. We should only be using disinfectants for surfaces.
Right.
Not to spray the airspace around you. And we can imagine that some people would react poorly to that.
Absolutely. Jen Mitchell, thank you so much for watching. Dr. Bell, Jen says, great discussion. Now, if children go back to school in the fall, what precautions should be taken by the administration and parents? And I know that the SC Ed task force has recently laid out some of their recommendations.
They have. I think the Department of Education is really doing a great job to get guidance about what the risks are and to put measures in place. And then this is everything they're looking at, from school buses and limiting the number of children on a school bus, and perhaps employing additional school buses and rotating a schedule so that there are staged entries. They're following recommendations or have guidance about the setup of classrooms so that the desks are separated, to reduce classroom size, to monitor for symptoms of illness, to make sure parents are aware that they're not sending children to school who are either with symptoms or may have been in contact with someone with symptoms. So the way that lunch service is being handled in these congregate settings like schools that I talked about, you're going to have prolonged exposure. There are so many issues for the Department of Education, for primary education and higher ed to deal with that it is a challenge, and it tells us a lot about what our new normal may look like. To keep us all as safe as possible. We're not going to be able to reduce the risk to zero, but there are many, many things that the Department of Education is doing and thinking of now that's going to be a big help to have our students return to safer environments.
Thank you, Jen, for your question. We're actually working on getting someone from the State Department of Education on coping with COVID. So please continue to check that out. Deborah Abraham says, thanks, Dr. Bell. You're the best. I know, Dr. Bell, that you've had several conversations with church leaders about restarting services, and some have opened successfully. Others have had some problems with reopening. And there are churches that remain closed. Churches and banks, as a matter of fact. What is your recommendation there?
Well, I want to applaud, anyone who has a leadership position in a community. And we know that our faith leaders, that people pay a lot of attention to guidance from our faith leaders. So I really want to applaud how much attention the faith community is paying to this, asking for guidance. And there's a wide variety of what we're seeing of what they're putting in place. We know that some churches are working on building, outdoor platforms so that people can go to church service outdoors or from their cars. We know that there are many different kinds of settings, from very small rural churches to our very large mega churches. And so what they have to have in place in the variety of those settings is different. But for the messages that they're giving to their congregations, for why it's important and why they're doing it, and how they can help. And regardless of the setting, the message is still the same. It's the masks, it's the social distancing, it's the good hygiene, and the cleaning of environmental surfaces. Churches have some special circumstances. So if they move from one service to the next, how do you clean an environment after a large number of people have been there? And they're following recommendations or asking for recommendations about what we just talked about, disinfectants and cleaning for high touch surfaces.
Yeah.
And discouraging for special services, we have these life-changing events for funerals, and we've had some devastating consequences following funerals where a number are religious services to make sure that those who have to attend, excuse me, are not at increased risk.
Right. Hoover Johnson says, thanks for all you do, Dr. Bell. Dr. Bell, let's talk about swimming pools. Does chlorine have an effect on the virus?
Chlorine does have an effect on the virus, but if you think about being in a community pool, you're not underwater all the time.
Right. Gotta come up. Yeah.
And you have to come up for air, and the respiratory droplets that can be expelled from somebody who's potentially exposed, there's not chlorine in that.
Yeah.
And so you have to look at pools like you would any other environment. Just because there's chlorine in the water, that is not controlling the potential contact of, you come up for air and you're sputtering out the water that, was in your nose and in your mouth. And you're it's just a fun place. You're frolicking around, you're in close contact. It's not easy to do that. I mean, maybe there are settings where you can be in a pool and you can play Marco Polo and stand 6 feet away from each other. But it's just to be mindful of, we cannot exclude all of these activities that are so important for our socialization, for our mental health, for our kids. We don't want them to miss out on these experiences. And to just be as mindful as we can, to be as safe as we can in all settings. I'm sure there are ways that kids could get in that pool. And kids are just a special circumstance. You can tell them to stay 6 feet away from each other.
That's right.
I've got kids, and I know that they are not doing what the state epidemiologist says. Try as we might. So, but we need to live our lives, and there are ways to do that safely. I'm just most concerned about a more cavalier attitude. I love to hear these questions because people are paying attention when they're asking these questions.
Yeah.
When they're not asking the questions, or they're saying that they're getting information from not credible sources, or that these don't exist, and that is where we get into trouble.
Yeah, absolutely. Another question is about handling money. What is the safest way to handle money? A lot of people are going to fast food restaurants and going through the drive-throughs and going to the banks or the drive-throughs.
Yeah, the biggest risk for transmission is from person to person, from people who are sick. There is a risk of transmission from environmental surfaces if the virus is present, and it hasn't dried out. It can be dried out by heat, ultraviolet light, but it's the duration. How long has it been there before someone else touched it? So handling money is it's kind of a dilemma. What I see is some people may handle money with gloves, but the problem with gloves is that people don't understand that if they have bare hands, they're more likely to wash their hands. When they wear gloves, they don't actually wash their gloves.
Right.
So if they're handling money, and I see some practices, since I'm not going in restaurants, I'm doing drive-throughs, they'll have a box where you can put the money in,
right.
But the money is still being handled. So again, you minimize the risk to zero. And any measures that are put in place to potentially reduce the exposure it's another level of helping with exposure. Collection plates in churches are there are ways to do that with a lockbox. We've made some recommendations about that. So just passing it from person to person is not a good idea.
Yeah. Patricia Williams watching from Charlotte. Thank you, Patricia, for watching. She says she washes her gloves. And Deborah Abraham, Dr. Bell, says use your card. Is that a better option, to use your card? Because you still sometimes have to pass it. Sometimes you can swipe it, but.
Yes, thank you for mention of that, because there are ways that you don't have to do the transfer. So when we can minimize by doing our own swiping, paying in advance online so that no money exchanges hands, that's a great idea.
Yeah. Vicki Mueller also says, thanks for asking about pools. She says her neighborhood HOA and neighbors have had heated debate in regards to opening the pool. So, folks are thinking about that. What about now, we talked about this off the air. I read an article, and this shows that we can't believe everything we read. I read an article that says the shape and size of your nose and nostril heightens or reduces your risk of catching the virus.
So I have a couple of thoughts on that. And one is that I think that's not credible. But the other way to look at things like that is, who could possibly have conducted a study to measure the size of people's nostrils to say that this group of people with nostrils of this size fared better than people with nostrils of this size? And so that's how you can be a little skeptical when they report things like that. I want to ask, how did you conduct that study?
Right.
And when the answer is you couldn't have, then you know that is not credible information. Yeah. And so we see from, all sorts of different, we have different facial features, different racial groups, facial characteristics. And what we're seeing is that, unfortunately, a little bit of everybody is getting infected, and I am not aware of any protective effect whatsoever by different facial features. I see no credibility with reports like that.
Okay. The final question that I have, unless someone online has a question, and this came up yesterday too on the show, it had to do with taking temperatures because we see a lot of times with some daycares have reopened, and of course, restaurants and different places open, and they're taking the temperature of the child employee. Well, board certified family physician Dr. Nicole Edwards says, well, that only helps if they do or don't have a temperature right there. Taking a temperature does not necessarily guarantee that the person is COVID free.
That's true, that they could have only a temperature at that point in time. It could be an extra measure of protection, especially in a daycare center or something like that. But in other settings, like a school setting, it's not feasible to check the temperature of every child.
Right.
If you have smaller groups, it might be possible. But the other thing to consider is that we also know that people can spread the virus in the 2 days before they develop symptoms. So you would not be catching people who are potentially contagious. We call them pre-symptomatic.
Yeah.
So they may be incubating, they may have been exposed, they can have a certain level of virus in the body that they're actually able to spread, but they're not yet showing symptoms. So monitoring for temperatures can have its place in certain settings, but it's not 100% that you would detect everyone. Just like everyone doesn't present with fever, cough, we see myalgias. There's a whole spectrum of the presentation of illness that we're understanding better now. Loss of smell and taste, things that we never anticipated.
Right. It almost seems like every day there's a new symptom, Dr. Bell.
Yeah, this virus is fascinating. We called it a respiratory virus, but we now know that it can affect almost every organ system in the body. Wow. The heart, the kidneys, the brain, the nervous system. So it has devastating consequences.
Yeah, and it's because it's so new. Is that correct? That's why it's still, it's still developing on what it is and what it ain't, so to speak.
Well, what we understand about it is what's still developing.
Yeah, yeah. Your blood type, Cassandra Moody wants to know, does your blood type make a difference? I've had this question several times.
I'm not aware of any studies, and I'm also not aware of any other diseases where blood type makes you more susceptible.
Okay.
So I'm skeptical of that.
Okay. Let's talk a little.
There can be studies that I'm not aware of.
Right. A couple of people are asking about the test. Deborah Abraham says a lot of family members say that the test hurt. She said she told them that it doesn't. She said maybe for about 10 seconds. And Hoover Johnson says the same thing. It hurt him for just a minute. I guess the nasal swab.
Yes, it can be uncomfortable. There's two different kinds of nasal swabs, though. There's one that is collected with a much smaller, they both look kind of like Q-tips, but one of them is a very small Q-tip. And that one, it's called a nasopharyngeal swab, or that one does have to be inserted really far back in your nasal cavity, and that's uncomfortable. And they really have to swab around good to get a good sample. The other one is a little bit larger kind of Q-tip device, but they only do the collection from the opening of your nose. So they don't go deep into your nasal cavity. And that one is pretty easy to tolerate, but it even for the one that's very uncomfortable, it only lasts for a few seconds.
Okay.
And then the other is a blood test for the serology test.
All righty. Okay. All right. Dr. Bell, in closing, can you just give us just a wrap up and some advice, what your recommendations are?
Well, my recommendations are that we are not anywhere near being out of the woods. We are going to be confronted with COVID-19 infections at a pretty high level in our communities for the foreseeable future with what we're looking at now.
Foreseeable future.
The recent increase. Well, I think that we are looking at months at a minimum. And actually, as we move into the fall, we're looking at the possibility for an upsurge of cases as we're looking at COVID-19 along with the flu.
Wow.
I think some of this increase in trends that we have seen recently over the last few weeks, if I can give some kind of a positive message, is that we can take much better control over that. But we only have a few simple tools. In the absence of a vaccine, all we have is, yes, it's the inconvenience of these masks and the social distancing, but I just do want to ask everybody, is that something that we can do? Right. That inconvenience and that sacrifice to make a huge turnaround in what we're seeing now and shorten the course, the heartache, the suffering, the deaths, the hospitalizations, all the inconvenience. There is a whole lot more that we can all do to change the course of this infection in our communities.
Yeah. Jen Mitchell has one last question, Dr. Bell, if you will. He says, why does the Black population have such a higher rate of COVID-19? I think you touched on that a little bit earlier.
I did. We're more likely to have chronic underlying conditions, but it is not just African Americans. There are other racial and ethnic groups who are similarly suffering some of the consequences. This includes Hispanics, Native Americans. And so it is because we have a higher incidence of chronic conditions that are associated with complications even before we were infected.
Right, because we're dealing with so many other things.
More asthma, more high blood pressure, more obesity. And so those are the contributors.
Yeah, and anytime you, and a couple of doctors have mentioned that's on the show, anytime your body is already dealing with something, when something else comes, it doesn't have what it needs to fight it. Is that a good analogy?
That's right. It's harder to tolerate an additional insult if your lungs or your heart are already weakened, if you have problems with your cardiovascular system, your high blood pressure, kidney disease. So all of those, your body is more susceptible because you can't handle another severe insult to those organ systems.
And when are we looking at a vaccine? Because you said until we get a vaccine, we really won't have a hold on it. And of course, it's still new. So what are you thinking, Dr. Bell?
Well, they're moving forward much more rapidly with vaccine development than has occurred with other diseases in the past. And what I understand is that there are at least 2 vaccines that are in certain stages of trials in the United States and in Europe, and there may be a third. But what vaccine development requires is that it has to be tested in humans. We have to make sure it's safe, and we have to make sure it's effective. And that could potentially take several more months. I think there are some really optimistic speculations that could be around the end of the year 2020. That would be much quicker than any other vaccine has been developed to my knowledge. But I think that vaccine developers are saying some optimistic things in that regard, and we will see, but it will be at least many, many more months before we have any evidence of a safe and effective vaccine.
Right. Dr. Linda Bell, thank you so much for joining us today on Coping with COVID. You're just such a wealth of information, and just we thank you so much for advocating. And like I said in the opening, you've been advocating for people of color at DHEC since 1993. So you're just such a trusted and hardworking authority, and we appreciate it. If people want more information about the fight, the DHEC's fight against COVID, how can they get more information and reach out to you if they need to?
Well, first, I would recommend our website for those who have internet access, because there's a wealth of information that's specific to COVID-19 and our communicable disease control program. So we have other programs at DHEC for those chronic diseases. So we have information about the risk of heart disease and diabetes and other chronic conditions from our chronic disease programs in DHEC. And so I encourage people to pay attention to the whole picture. Everything that we can do to minimize those other chronic diseases will put us in a good position overall, not just to fight COVID-19, but for better quality of life overall. So I would just steer people to scdhec.gov for the one great source of information.
Thank you so much, Dr. Bell. Please continue to post and share out this information in this show so that others can see all of this needed information from Dr. Linda Bell. Please be sure to follow me and like me on Facebook. Please go to the Tailor Made Productions page, like and follow that page, because Coping with COVID is going to move from my personal page to the company page, Tailor Made Productions. You can do that on Facebook, but please be sure to like and follow me on Instagram and on YouTube also, where you can also see Coping with COVID. Now, if you have a COVID-related message, product, or service that can help someone cope with COVID, please inbox me again at the Tailor Made Productions page or email thetailormadeproductions@gmail.com, and let's talk about how you can be part of coping with COVID. I usually leave with a reading from either Jesus Calling, or I've been reading Conversations with God, Dr. Bell. So let me read this. It says, "Protect your mind, my child. This is vitally important. Don't forget to call on the name of Jesus. Make it a habit just to call his name. The enemy will flee in the name of Jesus. When you are feeling down, remember to call on the name of Jesus. When negative thoughts try to resist your mind, call on the name of Jesus. We walk by faith, not by sight. All that I have, I give to you," God says. "Verily, verily, I say unto you, he that believe the work that I shall do will also be greater works than they shall do, because I go to my Father. Whatever you ask in his name, he will do." That's based on John 14, 12, and 13. This is Conversations with God from Dr. Cheryl Williams. She's at Agape Christian Counseling, Agape Training and Counseling Center. You can go to her website at agapects.com or call Dr. Cheryl Williams at 803-779-2777. Now, tomorrow on Coping with COVID, we'll get a sports update with WIS-TV Sports Director Rick Henry. And we're also going to talk to the City of Columbia about a proposal, Dr. Bell, to mandate face masks within the city limits. Friday, we'll talk to Dr. Daniel Lackman with MUSC. He's going to talk about COVID and high blood pressure. And then on Saturday, how COVID is affecting events like weddings. We'll talk to couples and event planners about that and more coming up on Coping with COVID. I'm Tre Tailor. Thank you so much again, Dr. Bells, for joining us today. Patricia Williams, Deborah Abraham, Hoover Johnson, everybody saying thank you so much. Again, we appreciate you. Take care and God bless. Thank you guys so much for joining us on Coping with COVID. Have a great day and wear your mask. Be safe.